Breaking news here at HLN. That woman right there, the dancing doctor, Dr. Wendell Boutte, has had her license suspended by the state of Georgia. In part, that ruling reads that her practice of medicine poses a threat to the public health, safety, and welfare, so her license suspended. We know her as the dancing doctor, so that gets our attention. But aside from the videos, there are 7 cases mentioned in the ruling by the Georgia Composite Medical Board. And one of the cases, in my exclusive interview with her, we had a chance to talk about a woman. It's a very sad case from February of 2016 who ended up with brain damage. Again, with privacy laws, the doctor could only say so much. But what she could say, here it is, that and so much more with Dr. Wendell Boutte. This may be the life-altering event you're talking about. Isilma Cornelius. Sad case, as she is now brain damaged.
2.5 years ago, Cornelius went to Boutte's premier aesthetic center for Botox and other minor cosmetic treatments ahead of her wedding. While in the office, she agreed to more, a surgical procedure that Boutte said could flatten her stomach. More than 8 hours into surgery, Boutte's staff called 911, according to court documents.
She is not awake. She is not awake, and she is not breathing. Is that right? Correct.
What can you say about that case and what has transpired?
Well, due to the fact that I'm not able to speak on past and current legal issues, all I can say is that after doing over 5,500 or treating 5,500 patients, the number of cases on each is about 6 cases per patient with the combination of work that I do. So you might say 30,000 cases on 5,500 people or so. There are sometimes unpreventable and unpredictable things that can happen in surgery.
If you're okay with this, her son, and I'll get to the question of what would you like to say to him and the family. I'll let you listen to him.
I have to basically help her in the bathroom. I have to brush her teeth. I have to prepare her meals, prepare her medication, of course, changing her clothes. Everything that we're so used to doing for ourselves, I have to do that for her.
Have you spoke to him much? Did you? He says you never apologized, did you?
Mike, as I stated, for 18 years in practice, nothing catastrophic, major, no lawsuits, no claims. When any one of my patients suffer any side effect, complication, because we're talking surgery, I'm so passionate about what I do and my patients. I relate to them on a human basis. Part of what they say my appeal is because I'm a down-to-earth person. I can talk to you. It's like the girl next door. You're a woman. You get me. You get the ravaging that a woman's body goes through in pregnancy and childbirth. You know, I've had these procedures done myself because I felt lack of confidence after. I'm glad I had my babies. I love them to death, 3 beautiful young men. But hey, after a hurricane or a tornado, there's collateral damage that has to be, or you want to be addressed, right? Anything goes wrong, I take it to heart. I don't sleep at night. So you asked me, did I apologize? Think about what I just said.
How much do you hurt for that case, for that family, for that son?
There is not a day or night that I don't think about that unpreventable, unpredictable event that changed my life 2.5 years ago. Not a day or night.
In that case, from what we gather, at the I think 911 had to be called.
Yes.
Which leads to, I think a lot of viewers think, well, why would you're performing a procedure? Why would you have to call 911? Aren't you and your staff, aren't you able to deal with emergency?
Okay, so in general, anytime and again, I'm not speaking specifically about any past or current pending legal cases, but just in general, when you're in medicine and when you're performing surgery, which I've been performing for a total of 25 years. I mean, you include my residency at Emory and then my 21, nearly 22 years of practice. Anytime someone is in a situation where you feel that you can go through your ACLS protocols of life-saving measures with your team, you call a code when something happens, if it's something like that, and part of the ACLS protocol
That stands for what?
It's acute cardiac life support.
Got it.
Okay? So if you're in a situation like that, the first thing you do is you determine is the patient arousable. The second thing you do is tell someone, call 911. That's part of the protocol. In a life-saving situation, you know, if something unpredictable happens, that's just part of it. So if I call 911 or have a staff call 911 and 911 is the ambulance is taking long, I call it a second time. So now I got two teams because I want to make sure that whatever is necessary to restore integrity of safety and balance, that's what I must do, not what it's what I must do. It's my duty, and I did that.
You do not have hospital privileges, correct?
I do.
You do. You do have hospital
Yes.
privileges. Should some procedures be done more in that setting? So in case something goes wrong, it's people are more on the spot to save a life.
Well, if you have let me just say this. As a board-certified dermatologist and dermatological surgeon, I follow the protocol of a board-certified dermatologist who actually changed the game of liposuction, okay, and wrote the protocols that were FDA approved for how to conduct safe, office-based, tumescent, meaning local anesthesia, liposuction. Jeffrey Klein. I follow those guidelines to the T because there's a lot of research to show that office-based local liposuction, or if you need to add IV sedation, you know, with a trained CRNA or anesthesiologist, that the outcomes could actually be better, especially where it comes to infection control and control of, as far as universal infection precautions, because hospitals are huge and lots of people are coming in and out, some with known diseases, some without known diseases and infections. So we know that sometimes you could contract infections in the hospital. So if you have a clean, isolated office setting where you have all of the emergency supporting equipment and you have a trained nurse anesthetist or anesthesiologist that's trained on airway and circulatory control and evaluation and monitoring, you could really do a great, safe job in an office-based setting.
You obviously have a thriving business.
I do.
Do you ever concern that, I'm not sure we got enough staff to handle all the procedures. How many procedures do you do in a day?
On average, about 3.
3?
Yes.
So you're never stretched too thin, or is there sometimes you're like, wait a minute,
Well,
I'm heading here and somebody else is watching this person, and I'm a little leery of that?
no, because they are straddled in such that it takes about, depending on what's being done in the patient and now, let's just say it takes about an hour to prep. And let's just say it takes about 2 to 3 hours to recover. And then in the meat of it, it's the surgery part of it, you might have 2 to 4 hours depending on the combination that's happening. So you add that up and it could be 8 hours for that patient, but only 3 to 4 hours of it was actually hands-on surgery. So when my team knows exactly what to do. They're well-trained as a well-oiled engine. Patient 1 comes in, we get her prepped, we get the surgery done. While I'm in surgery, you prep in the second, right? And so on and so forth. So in a 8 to 10 hour day, easy. If your staff is trained, we do this every day the same way, okay? Everybody knows their part. That's called, and we talk about teamwork. And it's all about getting the patient in, getting their surgery conducted in a safe and efficient, and making sure that the work, for me, is excellent. It's not good enough for it to just be good. It's got to be excellent. And then we get the patient prepared for home and, and whatnot, and recovery.
Do you perform all procedures, or anybody else that does anything?
I perform all the procedures, I do have supporting staff, but I perform all procedures.
And we will have more from Dr. Boutte throughout the afternoon. The breaking news, though, her medical license in the state of Georgia has been suspended. That happened within the last few hours. No comment at this point from Dr. Boutte, but we're going to keep trying. So a lot, hard to imagine, Lynn, all that's gone on. Sitting with her for more than an hour, getting her side of the story, and then now here we are, and her license has been suspended. So a whirlwind, really, as we continue to cover this case.